Hello, my name is Noelle. I will be introducing our group's presentation on Huntington's disease. Fook will be presenting molecular mechanisms, Ivan and Azadeh will be presenting current treatments, and emerging treatments will be presented by Monique. Huntington's disease is classified as an autosomal dominant neurodegenerative disorder. It's caused by multiple CAG trinucleotide repeats in exon 1 of the HTT gene on chromosome 4. The number of repeats can affect the severity and the onset of symptoms in this disease. This disease occurs in 5 to 10 individuals per 100,000 individuals. Some symptoms of Huntington's disease include motor and cognitive impairment, one of the major motor impairments being chorea, which is a sudden, uncontrollable, jerky movement. Other symptoms include loss of self and spatial awareness, depression, dementia, increased anxiety, difficulty speaking, and there is a potential for weight loss. The decline of the patient occurs over 10 to 20 years and can eventually lead to death.
Hi everyone, my name is Phil. I will be talking about molecular mechanism of Huntington's disease. Huntington's disease is caused by a CAG triplet repeat expansion in Huntington gene, which encodes an expanded polyglutamine stretch in the Huntington protein. The characteristics of Huntington's disease can be described as follows. Mutant Huntington has a tendency to form abnormal conformations, including beta-G structures. However, Huntington in large inclusions is not the primary pathogenic species in Huntington's disease. Abnormal proteins are handled by systems impaired in cells and tissues from Huntington's disease patients or models. Huntington is shortened, giving rise to toxic and terminal fragments. Post-translational modifications of Huntington influence toxicity through conformational changes, aggregation tendency, cellular localization, and clearance. Nuclear translocation of mutant Huntington strengthens toxic effects of the protein partially through transcription-related effects. Cellular metabolic pathways are weakened in samples from Huntington's disease patients and in models. Although clinical features of Huntington's disease can be mostly credited to central nervous system degeneration, some aspects of the disease could be mediated outside of the central nervous system, including weight loss and muscle wasting, metabolic dysfunction, and endocrine disturbances. Mutant Huntington could have effects on cellular metabolism in a variety of ways. The cell must deal with the unfolded and abnormal protein through mechanisms such as the ubiquitin proteasome pathway, autophagy, chaperones that require energy. Mutant Huntington could have affected mitochondria either directly or indirectly, which compromises energy metabolism and increases oxidative damage. The Huntington disease phenotype in mouse models can be improved by calorie restriction, showing pathways relating to aging and cell.
Following suit of Hook's explanation of current identified Huntington disease molecular mechanisms, it is important to note that those molecular mechanisms have been the foundation for much pharmacological research. Unfortunately, there is currently no cure for the disease itself. Therefore, focus of Huntington's disease medication is found to be on reducing chorea symptoms. As pointed out by Noel in the beginning of the presentation, chorea is the involuntary irregular movements of the arms and legs. Tetrabenazine and deutetrabenazine are the only FDA-approved drugs for chorea treatment in Huntington's disease. Now, the mechanism of action of these drugs is that both drugs deplete the central monoamines by reversibly inhibiting the vesicular monoamine transporter 2 protein, otherwise known as VMAT2. When these drugs bind to this important transport protein, the chemicals necessary for movement in the central nervous system, dopamine and serotonin, are not absorbed by the cells of the central nervous system, known as neurons. Because the neurons cannot fire or be activated by the lack of dopamine and serotonin absorption, the chorea symptoms are reduced, and thus you will see less of the irregular movements of the arms and legs. There have been other medication options, which include dopamine antagonists, antiglutamatergics, antipsychotics, and antidepressants. These medications are obviously used in order to address the various symptoms associated with the disorder. One thing to note is that the most common antidepressants of selective serotonin reuptake inhibitors are mainly used for treating depression and Huntington's disease and not help alleviate with the other symptoms. So all these other medications are limited to their main role. Mood stabilizing medications and anticonvulsants, which are types of drugs used to prevent or treat seizures or convulsions by controlling abnormal electrical activity in the brain. These drugs help with treating OCD, aggression, bipolar disorder. Those include sodium valproate and lamotrigine. And it was found in a recent study that carbamazepine is effective in reducing the severity of irritability. In addition to all this, there have been non-invasive strategies and lifestyle adaptations that can help with managing Huntington disease-like symptoms. These include physiotherapy and occupational therapy, where physiotherapy has the advantage of using electrical stimulation to promote better response rates for the patient, and occupational therapy, much like physical therapy, is just getting the hang of using body movements in order to improve frequency and intensity with one's own arms and legs for healing. And for the rare cases of the pharmacologically resistant Huntington's disease, there is a new alternative way using deep rate stimulation. It is an alternative surgical treatment that is used to improve these chorea symptoms. However, it does carry with it some additional risks, as this is a surgical treatment where they implant a subcutaneous impulse generator along with lead extensions and stimulation electrodes inside the human body. It does carry the risk of being prone for an infection because of the surgery, and or just mild inconveniences along with the nodes and the scent and the feeling of something inside your system and body, and of course the actual electrodes, which ideally would not be beneficial if they were out of sorts or out of whack and causing knee-jerk reactions by mistake. Following suit of me will be Acide, helping to illustrate some of the very many medications used in order to help treat the Huntington's disease symptoms.
As we can see in this table, these are the medications that are using for Huntington disease treatment to decrease the symptoms of Huntington disease. The class of medication like chorea medication, antipsychotic medication, antidepressant, SSRI, and mood stabilizer. They have a different mechanism of action. Chorea medication, the two that have been approved by FDA, tetrabenzyne and deutetrabenzyne, and medication antipsychotics such as olanzapine and risperidone. We have medication as SSRIs like fluoxetine and sertraline, or mood stabilizer as a carbamazepine. These are the medications that we are using for decreasing the symptom of Huntington disease. As a current pharmacological treatment, we have mood stabilizing medication that help for OCD, aggression, and bipolar disorder that managing the disorder in HD patients. Anticonvulsant like sodium valproate and carbamazepine with effective in the reducing of severity of irritability. Non-invasive strategies and lifestyle adaptation can also play a role in managing Huntington disease. Deep brain stimulation is an alternative surgical treatment used to improve the chorea symptoms for rare case of pharmacologically resistant HD and carry additional risk. As I watched the video of patients struggling with Huntington disease, my heart ached for those who had to face this terrible disease. It was like watching a slow-motion train wreck, seeing the body slowly betray the mind and emotion day after day. It was just too much to bear. But the story of Jasmine, a 25 years old girl from Tucson, Arizona, hit me especially hard. Jasmine's journey with Huntington disease began when she was in high school and her grandmother started showing visible symptoms. Over the years, she watched helplessly and the disease aggressively took over her grandmother's body. And then her own father started showing symptoms. And it was getting worse day by day. One day, he even overdosed on pills and had to be hospitalized. Jasmine was devastated and felt helpless. She didn't know what to do for her dad. But it wasn't until she got married and started thinking about her own future that Jasmine really began to feel the weight of Huntington disease. Everyone said, she looks like her dad. She had his eyes, his nose, and she wondered if she had inherited the gene from him too. She decided to get tested, and the day she received her result was one of the most heart-wrenching moments of her life. When the doctor handed the green folder with her result, her hand was shaking. And when she read the positive result and felt like her world had come crashing down, the news hit her like the ton of brick, and she couldn't stop crying. She felt like she was living on a borrowed time, always wondering when the symptom would start to appear. But through her tears, she found the strength to keep fighting, to keep advocating for herself and her loved ones. She refused to let the Huntington disease define her or her family. Jasmine's heart ached for her dad and the countless others who had been affected by this devastating disease. But she learned that she was not alone in her struggle and that there were others out there who were fighting the same battle. And Jasmine began to live her life with a new sense of purpose. She knew that her time was limited, but she refused to let the disease define her. She would live every day to the fullest, cherishing every moment with her loved ones and making the most of time she had left. Jasmine's story is one of the bravery, resilience, and hope. Despite facing an uncertain future, she refused to give up. She was a fighter. She is a survivor and a symbol of hope for all those who face the same challenge. And even though there is currently no cure for Huntington disease, Jasmine held on to hope that one day there will be a pharmacological advance to treat the disease, giving others like her a chance to fight back against the devastating illness. Living with Huntington disease is a constant battle, not just for the patient, but also for the loved ones. The disease robs its victim of their independence, mobility, and eventually their life. But even amidst the dark and seemingly hopeless situation, there is still a glimmer of hope. Thanks to advancement in medicine and the technology, researchers are actively studying the disease and are getting closer to finding a cure or effective treatment for Huntington disease. Although there is no known cure yet, there are potential drugs that therapies currently is developing that aim to slow down the disease progression or elevate its symptoms. This is hope for brighter future, provided a ray of light in the darkness that can be so all-consuming for those affected by Huntington disease. Knowing that there are people dedicating their lives to finding the cure is a course of comfort and strength for patients and their families. It giving them something to hold on to and motivate them to keep fighting and living their lives to the fullest. The hope of breakthrough in pharmacological research to treat the Huntington disease is a powerful reminder that there is always a reason to keep hoping, keep fighting, and keep believing in a brighter tomorrow.
Hello everyone, my name is Monique Kong and I will be covering the emerging pharmacological treatments for Huntington disease. So as we mentioned earlier, most of the treatments currently on the market for Huntington are really geared towards managing the symptoms. There is no cure for this disorder. But there are several trials that are currently in the pipeline for studying managing these symptoms and improving the overall lifestyle of Huntington disease symptoms. So two key trials I wanted to highlight. One is for pidopidine, and this is a drug that's currently in a phase 3 study, and this is by Prelemia Pharmaceuticals. And this drug is a sigma-1 receptor agonist, and it works by acting as a neuroprotectant by increasing brain-derived neurotropic factor. Earlier studies showed promising results in compared to patients receiving placebo. So this one is really promising so far. And this is geared at improving motor capabilities for patients. Another trial that's currently in phase 2 is for an antisense oligonucleotide drug, or ASO. This drug is actually being studied for multiple ailments outside of Huntington disease, but currently in the phase 2 trial, it's aimed at targeting the root cause of Huntington by lowering levels of mutant Huntington protein, which is the protein that is responsible for the pathway. And the ASO can be allele specific or non-allele specific, so it can target the mutant Huntington protein or the wild type. And there are currently 3 ASO trials currently ongoing for ASO, and this is by Genentech Roche. A few other emerging treatments that I wanted to highlight. One is dextromethorphan and quinidine, and these drugs are already on the market for managing emotional outbursts for other neurodegenerative disorders, but it's currently being studied to help Huntington disease patients with irritability symptoms. Additionally, there are some gene and DNA modification studies that are going on, one being an RNA interference therapy that's really looking at degrading the target mRNA to stop the protein synthesis. Another one I found interesting was chemotherapy, nitolitinib, which is actually already on the market for leukemia treatment, but a pharmaceutical company is also studying this chemotherapy for Huntington disease because the thought is that it's going to work to target the dopaminergic pathway for Huntington patients. So there are several treatment options that are currently going through clinical development. So we will stay tuned to see how those come out.